Welcome to the Step Point of View Study Guide, and in this lesson, we learn about phenylketonuria, maple syrup urine disease, Alkaptonuria, and homocystinuria. Phenylketonuria, or PKU for short, is caused by either the deficiency of the enzyme phenylalanine hydroxylase, which turns phenylalanine into tyrosine, or the cofactor that associates with it called tetrahydrobiopterin, or BH4. When BH4 is deficient, the condition is malignant. Because the phenylalanine can't be metabolized normally, it forms ketones that wind up in the urine. Phenylketonuria. These ketones include phenylacetate, phenylactate, and phenylpyruvate. This condition is an autosomal recessive condition which happens to every 1 in 10,000 people. This condition is screened for 2 to 3 days after birth, because while in utero, the mother can provide the proper nutrients because she has the enzymes. However, 2 to 3 days after birth, the infant no longer has the enzymes. Individuals with PKU will have a musty body odor because of the presence of phenylalanine ketones, which are aromatic. Intellectual disability, growth retardation, seizures, a fair complexion, and eczema are all symptoms of PKU. To treat PKU, patients are restricted to foods high in phenylalanine, such as aspartame, and instead increase tyrosine to make up for it, as well as supplementing with the necessary cofactor tetrahydrobiopterin. If a woman is pregnant and does not follow the dietary guidelines for PKU, the infant may be born with microcephaly, intellectual disability, growth retardation, and congenital heart defects. Maple syrup urine disease gets its name because the urine smells like maple syrup or burnt sugar. When branched-chain amino acids lysoleucine, leucine, and valine, I love Vermont maple syrup, are metabolized to enter into ketogenesis or gluconeogenesis, the amino group is removed by making them into alpha-keto-acids. The alpha-keto-acid dehydrogenase, which has the cofactor B1, metabolizes them to allow them to enter into these pathways. However, when alpha-keto-acid dehydrogenase is deficient, the alpha-keto-acids will build up in the blood and eventually end up in the urine, giving rise to the maple syrup-like odor. Other symptoms include vomiting, poor feeding, and later down the line, central nervous system defects such as intellectual disability and even death. It is an autosomal recessive disease, and the treatment is restriction of all 3 of the amino acids isoleucine, leucine, and valine from the diet, and to supplement with thiamine. Alkaptonuria is an autosomal recessive disease where there is a deficiency of homogentisic oxidase, the enzyme that degrades tyrosine into fumarate, which causes homogentisic acid buildup in the tissues. It is normally benign, and since homogentisic acid is a pigment-forming molecule, those with alkaptonuria have bluish-black connective tissues, ear cartilage, and sclera called ochronosis. Urine from these individuals will turn black if exposed to air for long enough. Homogentisic acid is toxic to cartilage, so alkaptonuria may present with arthralgia. Homocysteine is processed by either becoming methionine by methionine synthase, which requires cobalamin, vitamin B12, or serine can be added by using the enzyme cystathione synthase with pyridoxine, vitamin B6. Cystathionine is made, which later becomes cysteine. Folate is also involved in the role of homocysteine to methionine by the enzyme methylene tetrahydrofolate reductase, or MTHFR. Homocystinuria can occur when any of the following are deficient, all caused by an autosomal recessive gene. If cystathionine synthase is deficient, it will be converted to methionine instead, elevating methionine and resulting in not enough cysteine. Treatment of this form involves decreasing dietary methionine, increasing dietary cysteine, and B6 to promote cystathionine synthase activity, and B12 and folate. A defect in cystathionine synthase results in a decreased affinity for pyridoxal phosphate, or B6. Homocysteine levels increase and cysteine levels fall. Thus, the treatment involves hypersupplementation of B6 and increasing cysteine levels in the diet. A deficiency of methionine synthase causes homocysteine levels to rise, and simultaneously methionine levels to fall. Treatment is increasing methionine in the diet. Methylene tetrahydrofolate reductase, or MTHFR, deficiency is treated by increasing folate in the diet. With homocysteine levels high in each of these outcomes, Homocystinuria is the product. Homocysteine levels are high, osteoporosis is present, marfanoid habitus, ocular changes, cardiovascular effects, kyphosis are all symptoms. The cardiovascular effects are thrombosis and atherosclerosis, which increase the risk of a stroke or myocardial infarction. Like in Marfan syndrome, the individual will have a fair complexion, intellectual disability. Lens subluxation will even be present. However, instead of superior temporal subluxation in Marfan syndrome, in homocystinuria, the subluxation is downward and inward. That's all for this lesson of Step 1 review. We'll see you in the next video.